endometriosis is basically the lining of the uterus, which is called as the endometrial lining. If that goes and sits anywhere outside the normal uterine cavity, that is called as endometriosis. It could go and stick on the tubes, it could go and sit on the ovaries, it could go behind or in front of the uterus, that is on the urinary bladder, or behind on the part of the intestines, that is called as the rectum. And it goes and sits there. And the funny thing about this tissue is that it is a very hormone dependent tissue, as in it responds to the estrogen and the progesterone, the female reproductive hormones that are responsible for the menstrual cycle. So it keeps growing and shedding and growing and shedding in response to these hormones, even when it is sitting outside the uterine cavity. Now in this tiny diagram that you can see that I have put a little diagram of the uterus with its tubes and its ovaries. The inner little triangular cavity of the uterus, that is called as the endometrial cavity. Normally, the endometrium, which is the lining of the uterus, is present only and only within that triangular cavity. However, if for some reason it goes elsewhere, it goes and sits on the tubes or the ovaries or on the outside surface of the uterus, it's going to go and sit there and respond to hormones there. While this endometrial tissue is in the uterine cavity, if it grows and sheds, the body has a cavity that leads to the exterior, and this blood comes out as menstrual blood. But if this tissue goes and sits elsewhere, there's no outlet to it. So it keeps collecting. And specifically, if it collects on top of the ovaries, it forms a cyst. So therefore, you get a cyst or an endometriotic cyst of the ovaries. That is basically what endometriosis is. It's basically the presence of the lining of the uterus, the endometrial glands of the uterus, outside the normal uterine cavity. So let's come to why does it occur? So endometriosis is actually a very distressing condition to both the patient and the doctor. The exact cause for it is honestly unknown. But obviously, we have theories, we have scientific researches that try and bring you to a point of some sort of understanding of why this occurs. The most important thing that we need to understand is a genetic cause. If your sister or if your mother has endometriosis, you have a 20 to 30% higher chance of having it. So it is definitely something to do with the genes, specifically passed on from the mother's side of the family. Okay, it doesn't matter if your father's sister had it or your father's mother had it, but if your mother has it or your sister has it or your mother's mother had it, you have a higher chance of having it. Secondly, like I said, it is the presence of this endometrial tissue, which is supposed to be only in that triangular uterine cavity outside the uterine cavity. How does it go there? Normally, we have menstrual blood flows outwards and downwards and out of the body through the cervix, that is the mouth of the uterus, into the vagina and then to the body exterior. However, for some reason, if it flows back through the tubes, it obviously will go and spill specifically, like you can see in the diagram, the uterus, the tubes are leading and sitting on the ovaries. So mostly the blood flows back outwards and goes and sits on the ovaries. Okay. So there it gets deposited on the ovaries, it might get deposited on the exterior surface of the uterus, on the tubes, or behind the uterus or in front of the uterus. So that is called as implantation. That is, it has been taken from one place and put in some other place. That is implantation of the endometrial tissue outside the uterine cavity. It could be directly because of menstruation in the opposite direction, right? Suppose there is a block that the cervix, that is the mouth of the uterus, suppose it has become tight and stenotic because of a trauma or a surgery, etc. Or because of an anomaly with the uterus. Sometimes we have women who have a very tight cervix, which is just the way the uterus has formed in you, right? So in that case, the blood will flow backwards. Or sometimes it could be carried by blood or lymph, as we know, to various other parts of the body. So the most common site where you will have this, it's called as ectopic implantation of endometrial tissue, meaning it is an abnormal or a wrong position where the endometrial tissue has gone and got implanted. So that could be most commonly it's seen, like I said, on the ovaries, but it could also be seen on the exterior of the uterus, on the tubes, behind the uterus and in front of the uterus. Okay, and lastly, we have something called as inflammation. Inflammation is a normal term, we all understand it, but what is its role in endometriosis? This is very important because if blood, which is not supposed to be in a particular place, goes and sits in a particular place, the body has a mechanism where it cleanses itself. We have the white blood cells of the body. They go and attack anything that is foreign to a particular area in the body. So normally, if, like I said, retrograde menstruation occurs, menstruation the opposite direction, that is backwards through the tubes occurs, the blood or the endometrial tissue will be eaten away by your white blood cells. But suppose the white blood cells don't function how they are supposed to and they don't eat up the tissue enough. In that case, definitely we'll have a case of endometriosis where that endometrial tissue can sit on the ovaries and then become hormone responsive.